You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, vaginal restoration. With us, we have a board-certified dermatologist who's getting great results with her patients. I've had her on the program before. She's America's favorite dermatologist, Dr. Tess Mauricio. Dr. Mauricio, welcome back to the program.
Hi, Randy. Hello.
Good, good. Now, we've had you on the show talking about a bunch of things. Now, M Beauty, you call your clinics, and you have multiple clinics. For people that don't know your centers, and then we'll get into the topic,
Sure.
What are the different services you offer, and how did you get involved in vaginal restoration?
Good question. Well, people usually come to see us to turn back the hands of time on the aging process. So we're known for our time machine procedure, and we're known for cutting edge leading technologies like the ALMI fat transfer, regenerative stem cell technology, anything that really can turn back the hands of time, usually without surgery and minimal downtime and natural looking results.
I know your age, you're almost 50, and you look great.
Yes, well, no, I'm 45.
Okay, well, that's
I'm
almost
proud
50.
Of it. It is.
You look good.
Thank you. I'm proud of it. And how did I get into vaginal restoration? And that's a good question because I have been working with platelet-rich plasma for many years for skin rejuvenation. And platelet-rich plasma is really within our bodies. It's from blood. We collect patients' blood. We harvest growth factors from platelet-rich plasma. We would inject it to regenerate the tissues, the skin of the neck, the face, the hands, other areas. And then, looking at the studies on platelet-rich plasma, it's also used to regenerate other tissues. And because I would say 90+% of my patients are women, okay. Women talk, and then, they talk about, when I laugh, I leak, I have to be careful.
So incontinence, urinary incontinence.
Urinary incontinence. And data started coming in that shows that we can use platelet-rich plasma to treat incontinence.
Injecting into the area?
Yes, with the O shot. It's called the O shot. And I was personally trained to do the O shot. Started doing it. It's a simple procedure, and it is highly, highly effective. I was one of the first female doctors to actually treat patients for urinary incontinence and sexual dysfunction with the O shot.
And it works?
It works
like you've had people with
well.
Incontinence when they laugh, and now it's gone.
Yes, I've had my own staff. This is interesting. When I first started talking about actually doing some vaginal restoration, treatment of urinary incontinence with my staff, I was shocked because they all wanted to volunteer. And
oh, really? So it's very common, urinary incontinence?
It is a
really?
lot more common than I even expected. And basically what happens is, with women who have had vaginal childbirth, and you can just imagine the trauma that causes with the tissues in the pelvic floor, that thins out the tissue around the urethra where the urine comes out. When that loses its elasticity, it becomes floppy. It's not as good in kind of providing support. Simple things like jumping and doing your jumping jacks, laughing, running, if you're not crossing your legs, you're not prepared, sneezing, those kinds of activities can cause a leak. And it is very embarrassing, and it's something that women don't talk about because there's really no good non-invasive treatments for it. And when I heard about the O shot, I'm like, what's there to lose? We're only injecting patients' own platelet-rich plasma and growth factors, which I've used so many times, hundreds of times.
So stem cells in the area.
Yep, growth factors in the area.
And it tightens up.
It regenerates the tissue. Okay. So the old floppy, loose tissue becomes stronger, younger, healthier again, and it's basically better at providing support for the urethra. And what's amazing, Randy, is that the improvement happens sometimes within a week, sometimes within days. For example, one of my mom's sisters visited us from Canada. We went to the San Diego County Fair. She would need to use the bathroom every 30 minutes. She's always walking in the bathroom, and that's like a big pain if you're in a fair. And then finally I asked her, I said, why do you have to keep going to the bathroom? She's like, I can't hold it. I just, if I feel like an urge, I have to go. Otherwise I'm gonna leak and get wet, and it's embarrassing. And so then I told her, let me treat you with let me treat you. And I treated her. And within 2 days, we drove from San Diego to my Beverly Hills clinic, and she did not use the bathroom. And that's been
so for her, she said
over
that
6 months.
This would never happen before.
Yes. And she said she's been that way. She's in her 40s. She's been that way for at least 5 years. And she just thought that's just the normal way. It's just part of the aging process, and it does not have to be. And so now we've taken it beyond just the platelet-rich plasma. We now have a new technology and procedure we call vConfidence.
Okay.
This is a CO2 laser device, and you're familiar with lasers, and we've discussed lasers here before. How does it rejuvenate tissue? It's the same that it will do for the skin of the face or the hands or the neck. It will vaporize old tissue. It will cause new collagen formation. It will cause new formation of tissue, mucosa, and so the areas that are loose, the areas that are really starting to not function properly are better able to do it.
Okay, so we've talked about this urinary incontinence, but you're also treating women that have issues with like looseness.
Yes, absolutely. So
it's affecting their relationship or their self-confidence in their relationship, etc.
Yeah.
So it works for that.
Absolutely.
Like, so it's a tightening procedure.
So the vConfidence procedure is two-step. There is an internal treatment. There is internal handpiece. This is a CO2 laser. It sounds scarier than it is. It's completely painless. So we actually treat the vaginal canal. So those women who've had children, that vaginal canal has been traumatized, stretched, and with the normal aging process, and then with menopause, the tissue there just really ages. I mean, just imagine what's happening to your face as we age. That happens to all of our tissues. And so what that does is it can cause a lot of dryness. It can cause a lot of burning. It can cause, like you said, during sexual relations. They may have pain during intercourse. Sometimes some women, because of the changes in the mucosa, they get frequent infections, yeast infections, bacterial infections. And then some women, they just lose all sensation, where, sex is just not pleasurable and maybe even painful. And you can just imagine, if you're a woman in your 40s, imagining the rest of your life going through this, how that can affect not just your confidence, but affect your relationship with your partner.
So with these type of things, let's talk. We're talking about this vConfidence, right? The vaginal restoration.
Yes.
They go into your office.
Simple, yes.
It's virtually painless.
They walk in, we put numbing cream, just the same numbing cream we would use for our skin treatment for the outside. The internal treatments, like I said, we do treat the vaginal canal with a special applicator with the CO2 laser, and that is completely painless. The outside is treated, so we treat the clitoris, the introitus, we treat the area around the urethra, we treat the labia. So not only does the external appearance look better, but the tissue is younger, the tissue is healthier, and so patients will get more sensation. The patients will get, tightening effect that is noticeable by their partner. So, this is so funny, and it sounds serious, but it's really
yeah. It's a delicate issue
when girls get together, my patients,
this is what they talk about?
Yeah, we talk about it, and then when we see them, maybe a month later for follow-up, they're really, really giggling. They're so excited. They're so happy. They have this youthful, fun, sexy glow.
That's why you call it vConfidence.
Yeah, because it's beyond. And this is, again, going to my total beauty inner and outer beauty concept, is that there are all these certain things that happen to us with life, with the aging process, with menopause, that, affect our day-to-day lives. It becomes annoying. Think about every time you have to go to the gym, you can't jump. If you're gonna sneeze, you have to cross your legs.
Because of urinary incontinence.
Yes.
Okay.
Or, your husband wants to, get romantic, and you're like, I don't feel like it because I know it's gonna be painful after or during.
So you have stories where women that either had pain or these type of things,
stories
that's reversed.
get better.
Is that right?
Studies have shown that these kinds of treatments are about at least 80 to 90% effective with one treatment.
What are urologists or gynecologists? What are they saying about these techniques?
This is what's really exciting is that people say, well, you're a dermatologist. What do you know about that part, right? And I am aware of my limitations as a dermatologist. This is why I have partnered with my own OBGYN who delivered my son, Dr. Colleen McNally.
She's
and
well
her
known in San
practice.
Diego, by the way.
Absolutely.
Okay.
She's been in practice since 1992, really a world-renowned OBGYN who is also postmenopausal.
She's with one of the major hospitals here in San Diego.
Yes, and she has her own practice, women's health care. I've been going to her my son's now 11. She delivered him. And when this technology came out, she was the first person I presented this to. And then I was surprised because she said, Tess, I've had 3 children vaginally. I'm postmenopausal, so she's in that age group. She's already treated herself with all of the hormonal therapy that she recommends to her own patients. She's already gone through physical therapy, doing Kegels and everything. And she's like, it's just, it's not working. So she tried it. I treated her with the vConfidence treatment. I added some platelet-rich plasma in there the day before Thanksgiving.
So this is an injection and the laser combination?
Yes.
Okay.
So this is what we call our V-time machine procedure. I treated her the day before Thanksgiving. The next day, she was still able to prepare a feast for 12, so there's really no downtime. The treatment, she said, is really more tolerable than waxing. And in about a week, she sent me a text saying, it's amazing. She's like, she had a bout of bronchitis, and in the past, whenever she would cough, she would have a little bit of incontinence. She's like, I was coughing like crazy, no leaking, and she said.
So it's kind of a quick fix in a way. So
she's amazed, and so she was sold. So now we are partnering together to really get the message out there to the women, because obviously.
So there's hundreds of thousands or tens of thousands in San Diego alone
she says that
have this problem.
The majority of her patients suffer from either incontinence, the sexual dysfunction, pain during intercourse, dryness, no orgasm, women who've had chronic infections. A lot of women have these, and despite her best efforts with the medical treatment, estrogen, all kinds of different estrogen delivery system, sending them the physical therapy, all her expertise, she's like,
it wasn't working.
This really is going to help. And so that's what we're really doing.
Now,
I'm excited for the women out there.
So are they in and out of the office in a couple of hours?
Yes. They're numbing for about 45 minutes. The procedure itself takes about 45 minutes, and they walk out.
And then the results are pretty fast.
Yeah, they have to abstain from having sex for about 7 days. So for patients, that's kind of, and then they have to put ointment on the external surface, of the skin for about 7 days. But it's really nothing. And the alternative, there are ways to tighten the vaginal tract. There are ways to, kind of resuspend the area if you're having incontinence, but those are invasive surgical procedures that will cause scarring, that will cause loss of sensation because of the scarring. That will cause a lot of downtime. Can you imagine getting surgery down there? And so now what I tell patients, and this is what Dr. McNally feels very strongly about, this really adds the armamentarium that she has to help these women, and there's so many, millions of women are silently suffering, Randy, which is why I felt strongly to do this.
It's like a lot of the things we talk about in this show, and I've talked to you about, that even with, whether we're talking about lasers for the face or fillers or whatever, that if something bothers you about your appearance or something bothers you about whatever, it holds you back in life. That means you're less than. So this is also not for everybody, but if you're bothered by your incontinence, if you're bothered by maybe lack of sensation because of looseness, this is one of those things that works.
Yeah, it's worth a shot, literally. It's
worth a shot.
Yes, because, there's the cost and maybe the 7 days that you abstain from, having sex, but really most patients within a week find a difference. And the alternative, what is the alternative if you don't get it treated? Okay, for the rest of your life, our lifespan, we're supposed to be living till we're way in the 70s. If you're already starting to have these types of symptoms in your 40s, and
it just gets worse.
It just gets worse.
Really? Okay.
And then when you hit menopause, it just gets worse. But, women now, both men and women, but women now are more active than ever. I mean, I did a vConfidence on the patient who is in her 70s. She's still dating. She's going on a cruise with her boyfriend, and she wants to be ready. She wants to really have the full experience, and why not? You know, and like one of my patients told me, it's like she saw this commercial on TV for Depends, which is the
Depends
diaper.
underwear, yes.
Right, so Depends underwear, because incontinence is a huge problem. It's a woman who's beautifully dressed in an elegant gown, beautiful woman, middle-aged woman, and they showed her like taking off her gown, or she was wearing
an adult diaper.
Yes. I mean, how?
So she saw the commercial and thought, oh my goodness, that's where I'm headed?
Yeah. She's like, that is not right.
And then I have to see Dr. Tess?
She said it's not right to be wearing, you know, a beautiful gown and then wearing diapers. It just brings your spirit down. This is what
I mean, I know the cost. It's not a lot of money. So the women out there, we could fill Qualcomm with the amount of people that have urinary incontinence. Is that fair to say? I mean, it's that big of a deal. But it could be treated.
Exactly.
So what's their hesitation? They don't believe it works. They don't even know about it, probably.
Number one is they don't know about it. Because even Dr. McNally, who is, who does a lot of research, and
she's the gynecologist.
Yeah,
yep.
she's really always on the cutting edge, and she's done a lot of research before she obviously decided to have the procedure done. She's really on the cutting edge. So we are just now starting to create awareness in the medical arena about this. So first you have to kind of create awareness with the doctors. You have to create awareness with the general public. Most women just think this is part of life and of aging, and they just have to live with it.
Doesn't have to be that way.
It doesn't have to be that way.
When you say, backing up, you mentioned it can help with recurrent infections, urinary tract infections. Is it because people with urinary incontinence, they have more bacteria in that area, and if you stop that, well, I mean, help me understand, what's the mechanism here?
So the mechanism is that as the vaginal mucosa changes with aging and with menopause, you change the pH. So the normal bacteria, the normal flora that lives there is changed. And so then patients become more susceptible with yeast infection, bacterial infection. Many women are on chronic antibiotics or chronic anti-yeast medications just for that, time that maybe they're going to have sex, because every time they have sex, they get an infection. Can you imagine that? And so when we do the vConfidence treatment, your mucosa,
that's a shiny area like in your mouth.
Exactly.
You're rebuilding that?
Rebuilding that. You're rebuilding the collagen, the thickness, the support of the area. The mucosa is restored to where it was when it was younger.
Is that why the vaginal dryness may go away as well?
Yes, exactly.
Because the area is healthier?
Mm-hmm. So the secretion is normal. So the vaginal dryness, which is why as women age and with menopause, one of the most common complaints is vaginal dryness.
And have you witnessed, with your own patients that you've been doing this with?
100%. Many women who have pain during intercourse or after, they have like this kind of what they describe to me as sandpaper-like feeling inside for days after, is because of dryness. And there are, like lubricants out there, external lubricants, but some women are allergic to it. It's messy.
So they can lose the lubricants?
Yeah.
And after this treatment,
just
does
like
it take
how it
one or
was
two?
when they were younger.
Do you have to keep it? Is it like your face? Like you do this once a year, every couple of years?
Same concept. So it's best done. Some women will respond amazingly after one. Some women will require more than one treatment. And also we have to look at the woman in the whole picture, right? So that's why being partnered with Dr. McNally, we can really assess, do they need hormones? Because, it's not just all anatomical. What we're talking about with vConfidence and the V-Time machine is really restoring the anatomy to where it used to be. But hormones play a role, so she's going to assess the patient if they need hormone replacement, especially after menopause. She's going to assess maybe there is true infection that's causing the burning, make sure. Also, she will assess if women have other issues, whether there's a growth there. So we want to make sure that the pap smear is normal, and that the women are healthy enough and there's no contraindications to basically have a laser treatment and PRP treatment done in the area.
Now help me understand as far as the pain. So people that have pain there during intercourse, is it like your gut, right? If you have a thin mucosal lining, you're going to have sore stomach all the time. So
Right.
now they can build that up and they don't have a sore stomach.
That's a really, yes, exactly.
same
So
kind
you
of
have
thing?
little cuts, you have little nicks, and as the tissue gets thinner, it's just like our skin
So they have
gets thinner. Thin tissue, thin skin, less glands that are secreting properly. And so very easily, you can easily tear the area with a little trauma. And then now because there are nicks there, bacteria and, fungus can populate it and easier. So that's kind of the cycle that happens. And again, we're talking about the physical effects, but the emotional and spiritual effects of having this condition for years takes a toll on a woman. I have patients.
They tell you that they're bothered by
I
it.
have patients who say they've never. The ones who we haven't talked about urge when they have to go to the bathroom all the time through the night. I have patients who have not had a full, uninterrupted sleep for years because they have to go to the bathroom 2-3 times at night. And one of my patients, we treated her within a week. She called me. She's like, I just had the very first sleep, uninterrupted sleep in 10 years. You can imagine how that affects your mood if you're not getting good
knowing
sleep.
you're going to be on the show today, what was the main message you want women to know? Because it is a delicate issue. Was it the incontinence? Was it the looseness? Well, I mean, what's your main
I think it's always my main goal is that whatever it is that is bothering you, like you said, that is stopping you from, enjoying life, living life with vitality, with bliss, with joy. If it's physical, right? Physical, your skin, your, unwanted fat, and now, how you feel if you have incontinence, if you have issues with when you're having sexual relations. Come and get a consultation, get educated, because you would be surprised. There's so much new technology that even doctors are not even aware of yet. And so really it's to create awareness and let people know, and in this show, let women know that there is so much available. We now can harness our own body's ability to heal and regenerate itself so that we can live our best lives.
So most women with urinary incontinence are going to their gynecologist, a urologist, whatever.
Yes.
Right? And they may be watching this saying, well, why didn't my gynecologist tell me this? Because, they're smart.
Yes, well, it's just like anything, unless you're educated in it.
But across the country, they're
know.
being brought up to speed. They're
Absolutely.
believing in this.
Yes, and more studies are proving it. More and more doctors are really getting on board. And so my hope is that, there will come a time where this will just be part of the normal maintenance.
I know you lecture, right, to dermatologists across the country.
Yes.
Is this one of your talks yet?
Absolutely.
Is that right?
Yes. So this is definitely something we're going to take it on a road tour and get it out there. But because now we have better technology than even when we started doing these, we have social media. And the hope is that, when we can affect, the people that we can, Dr. McNally and I can see in San Diego and in California, that the message can spread across the world.
Good. So we're short on time. But as a recap, for people just tuning in, we're talking about vaginal restoration. So you are using both laser technology to rebuild the area, to clean up the area. You're also using injections of stem cells in the area to help with tightening, urinary incontinence, urge to use the restroom, you say goes away, people with painful sex, recurrent infections.
Right, so it's not actually stem cells that we're injecting. We're injecting growth factors using our patient's own platelet-rich plasma. But essentially what that does is it maximizes the natural ability to regenerate the tissue and decreases inflammation so the downtime is very little.
So this is, how do you compare this with your cosmetic practice? I mean, is this a happier group of patients? For many of these people?
It's a happier group of patients because I think there is nothing that is linked closer to our spirituality and self-confidence as women as, the vaginal area. And so I think for those women out there who are wearing diapers, who are having to limit their activities because they need to use the restroom, plan their days based on restrooms, avoid, sexual relations because it will hurt. I think that, when you don't have those problems, your brain's freer, it'll be happier, you live lighter.
One less thing to worry about.
Yes. We have so many things to worry about already as women. We don't need this one. And it's treatable, and it's easy, and it's safe.
So So I know, so somebody's watching this, they have the symptoms you've talked about. They go in, they meet with you. Do they always have to also meet with the gynecologist? Or do you?
Well, we want to make sure that they have had a recent normal pap smear. And so if they can get a note from their doctor that they've had normal pap smear, then we're ready to go with the treatment.
And it doesn't hurt that much?
No, it's just under local anesthesia, numbing cream. They hang out there in their clinic for about 45 minutes. We do the treatment, and then they're walking out. And 7 days where they have to abstain from having sexual relations and putting some ointment. But most patients are so pleasantly surprised at how easy the procedure is, and they're pleasantly surprised at how effective it is.
You've treated, we won't mention who they are, but you've treated some of your own staff, your own team.
So we have,
with urinary incontinence.
Yes.
How did it work for them?
It worked amazingly well. So if you're calling M Beauty, you can talk to Valerie, Lisa, and Veronica. They all have had these treatments. They're huge believers, and they're great educators as well. And
so if you've had a baby, you may have this problem.
There is a very, very high chance you will get this after the age of 40 if you have had vaginal delivery. But some women, even if they've never had children, if it's genetics, they can have it even as early as in their 20s. And so the idea is that we now have a solution for urinary incontinence, sexual dysfunction, painful sex, if you've had chronic infections, if you just don't like the way that vaginal area looks. A lot of women are single in their 40s, 50s, and older, and you're dating and you're dreading that time, you're turning off the lights. You don't have to. We can improve the appearance as well.
Okay, good. And they could follow you on Facebook, on your public profile.
I'm all over social media. You can go to you can just find Dr. Tess, DRTESS, and follow me. I have Facebook live posts as well. You can go on our website at mbeautyclinic.com.
It's really good, by the way. I mean, I learn a few things. I mean, you could probably see that I'm peeking in every once in a while, right?
Yes. It means a lot to me.
Mostly the skin stuff, like that's what you're talking about. It's great stuff.
Well, this is, like I said, this is sort of, as a dermatologist, but more I look at it as a female doctor.
Good.
And the majority of my patients are women, and this really completes it, where I'm really helping them outside and inside.
Good. I have to ask you about medical insurance. Does medical insurance cover this at all? Not yet, probably?
Not yet.
But it's not that much money anyway. And you have financing for people on a really tight budget.
There's care credit financing. It is worth it. It is really worth it. The amount of improvement in your quality of life, the enjoyment of your life, the confidence that you'll get, the happiness that you'll get, it is worth it.
Sounds so simple, by the way. Is it that simple?
It is simple
if
it's done by an expert.
They're saying, I've been doing everything, right? Yeah. They're doing the Kegels, they're doing everything. But in one afternoon...
Dr. McNally was surprised. She was sold.
Okay, good.
So
I want to thank you for coming on the show. Good stuff. You've been watching The Wellness Hour. I'm Randy Alvarez for now. I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.